Hi, I'm Prateek, and in this video we're going to be looking at the anatomy of the tongue. Remember, if you want thorough revision notes, exam cheat sheets, CPD, along with a huge bank of exam style questions and guidelines, head over to ExamineDental.com. We also have expert one-to-one mentoring sessions in order to help you ace those interviews and exams. When considering the anatomy of the tongue, the first thing that we will look at are the muscles. The muscles of the tongue can be divided into two broad categories. We have the intrinsic muscles, which form the body of the tongue, and we have the extrinsic muscles, which insert into the tongue. The intrinsic muscles originate within and attach to structures within the tongue. There are four sets of paired intrinsic muscles. These are the transverse muscles, the vertical muscles, the superior longitudinal and the inferior longitudinal muscles. Ultimately, these muscles are crucial in determining the size and the shape of an individual's tongue. Separate to the intrinsic muscles, we have the extrinsic muscles. The extrinsic muscles originate from structures outside the tongue, and then they insert into the tongue. There are four extrinsic muscles that we should be aware of. First, we have hyoglossus. Hyoglossus originates from the hyoid bone and it inserts into the lateral aspects of the tongue. It helps to depress and retract the tongue. We then have styloglossus. Styloglossus originates from the styloid process and inserts into the lateral aspects of the tongue, similar to hyoglossus. Styloglossus helps to retract and elevate the tongue. Next, we have genioglossus. Genioglossus originates from the genial tubercles of the mandible. It then inserts into the hyoid bone as well as the entire body of the tongue. Genioglossus helps to protrude and depress the tongue. And finally, we have palatoglossus. Palatoglossus originates from the palatine aponeurosis and predominantly inserts into the lateral aspects of the tongue. Palatoglossus helps to elevate the posterior tongue. The names of these muscles give a really good hint as to where they originate from, and this is a useful tip for exams. Next, we'll look at the innervation of the tongue and the muscles associated with it. When considering the innervation, we can divide it into both the sensory and the motor innervation. When looking at the sensory innervation of the tongue, we can divide the tongue into the anterior 2/3 and the posterior 1/3. General sensation to the anterior 2/3 is provided by the lingual nerve, which is a branch of the mandibular division of the trigeminal nerve. Taste sensation to the anterior 2/3 is provided by the cauda tympani nerve, which branches from the facial nerve. In the posterior 1/3 of the tongue, both taste and general sensation is provided by the glossopharyngeal nerve. With regards to the motor innervation of the tongue, all the intrinsic muscles and the extrinsic muscles are supplied by the hypoglossal nerve, apart from palatoglossus. Palatoglossus is innervated by the vagus nerve. When we look at the vasculature and the lymphatic drainage of the tongue, it's relatively simple. Majority of the blood supply to the tongue is from the lingual artery, and this is a branch of the external carotid artery. Sometimes there can be a little bit of blood supplied from the tonsillar artery, which is a branch of the facial artery as well. Venous drainage from the tongue is carried out by the lingual vein. Similar to the sensory innervation, when we look at the lymphatic drainage of the tongue, we can divide the tongue into the anterior 2/3 and the posterior 1/3. The anterior 2/3 drains into the submental and submandibular nodes. These then drain into the deep cervical nodes. The posterior 1/3 of the tongue drains directly into the deep cervical nodes. A lot of the anatomy of the tongue can be linked together when we consider the embryology of the tongue. Development of the tongue occurs predominantly from the first four pharyngeal arches. This explains why we have the varying innervation of the muscles and the sensation in the tongue. We have the first pharyngeal arch that contributes the trigeminal nerve, the second contributes the facial nerve, the third contributes the glossopharyngeal nerve, and the fourth contributes the vagus nerve. So in this video, we've touched on the muscles of the tongue, both intrinsic and extrinsic. We've looked at the vascular and lymphatic drainage of the tongue. We've looked at the innervation of the tongue, both motor and sensory, and we've touched a little bit on the embryology of the tongue. Remember, if you want to get more detail on this topic, then you can head over to ExamineDental.com, where we have a revision note and a cheat sheet for your exam ready to go. I hope you found this video useful, and if you did, please make sure to like, comment and subscribe. There are lots of other similar videos on the ExamineDental YouTube channel, so make sure to check those out. Until the next video, take care.